Hi, my name is Iris Hobson, and I'm here to discuss birth control methods. One of the things to consider when choosing birth control is the different rates of effectiveness in preventing pregnancy among the different methods. Perfect use refers to the success when used consistently and correctly all of the time. Typical use takes into account how the average user uses it on a daily basis. Barrier methods prevent sperm from meeting the egg by ways of a barrier. Condoms can be made of latex, polyurethane, or animal tissue. The condom captures sperm and is fitted over the erect penis. Male latex and polyurethane condoms help protect against many STDs, including HIV. However, the condoms made from animal skin are not as effective in preventing STD transmission. The advantage is that they are inexpensive and available without a prescription. However, some individuals may express that they have a reduced sensation, and people allergic to latex should avoid the use of latex condoms. Female condoms are made of polyurethane. They are held in place by two flexible rings that covers and lines the vagina. It is inserted into the vagina before intimate physical contact occurs. The ring at the closed end is placed in the vagina and covers the cervix, and the ring at the open end remains outside. They are inexpensive and available without a prescription, and it helps protect against many STDs. And a disadvantage is that it must be inserted before intercourse and can cause irritation for one or both partners. The cervical cap is a deep silicone cup that is shaped like a sailor's hat and is fitted around a cervix. A healthcare professional must determine the correct size. The cervical cap must be coated with spermicide prior to intercourse, and after intercourse be left in place for at least 6 hours. The cervical cap should not be worn more for 48 hours. A disadvantage is that a proper fit is necessary for it to be effective. It is also less effective for women who have given birth because the birth process stretches the vagina and cervix. People allergic to silicone or spermicide and women with a history of toxic shock syndrome should not use the cap. The diaphragm is made of latex. During a pelvic exam, a healthcare professional determines the correct size of the diaphragm. The diaphragm must be coated with spermicide prior to intercourse. After intercourse, the diaphragm should be left in place for at least 6 hours. It should not be worn for more than 24 hours. Factors such as weight gain and weight loss can affect the way a diaphragm fits. The diaphragm must be inserted before intercourse, and it requires proper fit to be effective. A disadvantage is that it increases the risk of bladder infections. People allergic to latex or spermicide should not use it. It should also not be used by women who have frequent urinary tract infections, a history of toxic shock syndrome, or other related medical conditions. Spermicides is a chemical inserted deep into the vagina before intercourse to block and kill sperm before they can penetrate the uterus and fertilize an egg. They are also used with some of our other methods. It can come in the form of foam, cream, tablets, or gels, or suppositories. Spermicide is inexpensive and available without a prescription. However, it may irritate the vagina or penis, increasing the risk of infection. Hormonal contraceptives is based on a combination of estrogen and progestin. They are prescribed by a healthcare professional, and have some advantages and disadvantages. Hormonal contraceptive can allow for uninterrupted intimacy and also make periods lighter, shorter, and more regular. The combination may also lower the risk of some cancer, osteoporosis, ovarian cysts, and pelvic inflammatory disease. And they come in different forms. The combination pill is taken orally each day and comes in packs of 21, 28, or 91 days. The hormonal ring is a small flexible ring available by prescription. A woman places it in her vagina and removes it after 3 weeks and inserts a new ring 1 week later. The advantages are similar to that of a pill, but there are no pills to take. It may cause some vaginal irritation or infection or increase vaginal discharge. The ring may not be recommended for women with a weak pelvic floor muscle or chronic constipation. The hormonal patch is a thin plastic patch available by prescription and attaches to the skin. It is worn 1 week at a time for 3 weeks. The advantage is a pill does not have to be taken. However, all these hormones that are in combination have the same disadvantage. The hormonal patch, ring, and combination pill can increase the risk of blood clots, stroke, heart attack, or high blood pressure. Also, it may cause bleeding between periods, changes in weight, depression, or breast tenderness. In addition, the patch may not be effective for women who weigh more than 198 pounds. An option for those women is progestin-only contraceptives. Progestin prevents pregnancy by providing consistent doses of progestin to thicken cervical mucus, change the lining of the uterus, and sometimes prevent release of the egg. The progestin pill is safer than combination. It can be used while breastfeeding, and it may protect against certain cancers and conditions. Progestin can also be given in a hormonal injection. It is an injection given every 12 weeks by a healthcare provider. It also prevents pregnancy by thickening the cervical mucus, changing the lining of the uterus, and preventing release of the egg. However, a disadvantage to the hormonal injection is that it may cause bone loss with prolonged use and increase the risk of osteoporosis. Women who are seeking to have a return of fertility in less than a year should not consider this method. Implanon is about the size of a matchstick, and it's placed under the skin inside the upper arm. It releases a low dose of progestin that prevents pregnancy. A single rod can last up to 3 years. A healthcare professional must remove a rod, and then a new rod can be inserted. The advantage of this type of contraception compared to the injection is that there is a rapid return of fertility. Progestin can also come in the form of an IUD. It is a small plastic device containing hormones. It is inserted into the uterus by a healthcare professional. It prevents sperm from fertilizing the egg, and it changes the lining of the uterus. It can be left in place for 5 years. However, IUDs are more commonly recommended for women involved in a mutually faithful long-term relationship. The hormonal IUD can reduce menstrual cramps and flow, and it can be used while breastfeeding. However, the hormonal IUD increases the risk of ectopic pregnancy It should also not be used by women who are pregnant or have a history of certain liver conditions. The IUD can also come in a copper form without progestin. It is also inserted into the uterus. It can be left in place up to 10 years. However, the disadvantage is that there is an increased risk of ectopic pregnancy also, and it can cause heavier and longer periods. Women allergic to copper should not use the copper IUD. Fertility awareness methods can be used to prevent pregnancy. There are many different methods, such as recording body temperature, observing cervical mucus, and recording menstrual cycles. However, it must be taught by a healthcare provider. Fertility awareness methods should not be used by couples who are not committed to careful recording and to abstinence during fertile periods. We also have emergency contraception. It is used to prevent pregnancy after unprotected sex. This should not be used as a regular method of birth control. The pills are taken within 72 hours of intercourse, and the pills are available from a pharmacist for women or men ages 17 and over. Sterilization is considered a permanent protection against pregnancy. No confirmation is required for surgical sterilization of the female. It involves a technique where the tubes are cut and tied, sealed, or blocked. However, the female must remember that this is generally irreversible. In male sterilization, it is completed by a surgical procedure called a vasectomy. However, there must be a follow-up sperm count to ensure that the male is no longer considered fertile, and it is considered irreversible. Remember, most contraceptives are highly effective in preventing unwanted pregnancies, and some contraceptives help protect against STDs. However, only abstinence is 100% effective in preventing pregnancy and STDs. Some people should not use certain contraceptives. Make sure you talk to your health care provider for more information. Remember, contraceptives are only effective when they are used correctly and consistently.